Welcome to the 2012 National Kidney Foundation meetings. I'm Tejas Desai on behalf of eAJKD, the official blog of the American Journal of Kidney Diseases. I'm pleased to be joined by Dr. Jawad Sher of Indiana University, who's going to be discussing with us his research in paired kidney donation. So Dr. Sher, welcome.
Thank you.
Why don't you tell us a little bit about the research that you've been conducting and that you're presenting here at NKF?
As you know that kidney transplant is one of the best way of chronic kidney disease patients or patients who ultimately move on to end-stage renal disease have in terms of improving the quality of life. Historically, studies have shown that patients after receiving their first transplant, when the transplant fails, they have the option of either looking for a second transplant or going on to dialysis. And as we already know, the quality of life and all the other factors are much better for a transplant patient than a patient who is on dialysis. Historical data has shown that the outcome in patients who are getting a second transplanted kidney or a retransplant are inferior compared to the patients who are getting the first kidney. So we have done a study to look at the outcomes in two groups of patients. Basically what we have done is we have taken two kidneys obviously from a deceased donor, and one of those kidneys went to the patient who was getting it for the very first time or a primary transplant recipient, and the second one went to a patient or recipient whose first kidney has failed or a retransplant recipient. And then we have looked at the outcomes in these two groups by taking the donor as a common source for both the primary and the retransplant. We have tried to minimize the biases that can happen because of the donor factors. So you can obviously have outcomes which are dependent on the donor factors and on the recipient factors, but we have tried to minimize those biases and just focused on the outcomes when the donors are seen.
I see. Now, you looked at a variety of endpoints, some of which include the number of acute rejections, the number of days that rejection occurred, the creatinine level at different points of time. Can you tell our viewers some of the data that you've uncovered through this trial?
As we were looking at our data, the group that we had, the ones who were getting the primary transplant, and compared that to the group who were getting a retransplant, there was a statistical difference between their PRA percentages and also being diabetic. To our surprise and to a positive surprise, we found that all the other endpoints that we looked at in terms of rejections, days rejections, the creatinine at 1 year and creatinine at 5 years were not statistically significant between the two groups. In other words, we found that there were no more rejections in the patients who were getting a second kidney. Their renal function was not statistically different from the patients who were getting a second kidney, and in summary, the outcomes were very similar.
Now, where do you and your research team go from here?
I think one of the things that we look forward is to encourage people and patients to consider a second transplant, and for that matter, we are assuming a third transplant if their first or the second transplant fails. The half-life, depending on which study you look at, for a transplanted kidney is about 8 years. So you know that the younger you are, there is a very big likelihood of your kidney ultimately failing. And instead of going on dialysis for the rest of your life, patients should consider a second transplant as an option, because that is going to improve their quality of life. And we have already shown in our study that the outcomes are very comparable compared to the first time when they got the kidney.
Well, thank you, Dr. Sher, for presenting this information to us, and welcome to the NKF. We really appreciate having you here, and we appreciate having you. Thank you for joining us.
Thank you for having me here.